Are you experiencing creepy crawlies down your legs, or maybe a pins and needles feelings down your arms and hands, or maybe some form of that? Maybe you're experiencing sciatica. This is what we're going to call some form of neuropathy. Neuropathy is a pathology, or it's a disease of where we're seeing that we have neurological impingement. Now, a lot of times, we have clients that come in here, and we've dealt with hundreds of cases over the years of clients with some form of neuropathy. And in fact, we just had 3 cases this week that have come in and said, hey, I'm really feeling my symptoms and all of my effects of this are starting to improve. So again, with neuropathy, and what we see typically with that is a neurological impingement. When people start first feeling those signs and symptoms, especially like when I'm going to call it the pins and needles, or my arm feels like it's going to sleep, a lot of times the common thinking is people feel that it's a circulatory issue. They feel like they're not getting blood flow, maybe their muscles, and they start to shake their arm, and then all of a sudden the symptoms start to dissipate. That's where it would, I'm going to say, typically would start. But actually what is going on is there is some form of neurological impingement coming from either the neck, somewhere down the shoulder, or somewhere down into the arm and hand. And a lot of this can be classified as carpal tunnel, any number of signs or symptoms like that. Where we also would see it would be down into the lower leg, or into the hip and glute. So in the hip and glute, we would call it sciatica. It could be coming down through the back area, coming down the back of the leg. It could stay between the hip and the knee, or it can run the full leg all the way down to the foot. Or maybe it's just mostly just affecting the lower region, just like in the foot and region and stuff like that. It can also be running across the front of the thigh. So if we see, again, any of those signs or symptoms, we're looking at there's neurological impingement, not a circulatory issue when we see those types of issues. And it can come in many different shapes and forms. So again, a common thing that we hear is people talk about, I've got creepy crawlies, I've got this tingling sensation. It feels like my nerves are pulsating, I'm getting a pulling sensation. Muscles are actually pulling or having this burning sensation. Those are going to be a lot of the signs and symptoms of some form of neuropathy. Now again, with this, as we talk about these neurological impulses and how they're actually compromised, there can be different causative factors, and that can fluctuate from person to person. So sometimes they're mechanical in nature, meaning that it's a neurological impingement causing by some sort of vertebral instability, whether it's in the neck, mid-back, shoulder, or in the lower back or the pelvic region, or even further on down into the leg. It can also be metabolic in disorder, meaning coming from some form of like diabetes. So meaning there's a sugar, there's excessive sugars in our body that's actually creating an attack on the myelin, which is the sheathing that covers the neurons itself, the nerves themselves. So it's a good importance to take a good, careful history and really kind of delve deep into understanding what is truly causing some person's neuropathy, and having that understanding, again, as it can show up in many different shapes and forms and affect many different parts of the body. So I want to introduce myself. My name is Dr. Sweeney, and I've been practicing here in Austin for about 20 years, and I practice a very unique technique, chiropractic technique. It's an upper cervical called the NUCA method. Now, with the NUCA method, it is a very gentle technique. We do not do any twisting, popping, or cracking, and we take 3 very precise x-rays to determine how the spine may be broken down, how the spine may be distorted from the head and the neck, from the junction of where all neuron responses start in the brain and how they transverse down through the spine to different parts of the body. And if we find that those signals are being compromised, then it's going to affect anywhere from here on down. So we work on that, addressing neurological impingement. Again, as a chiropractor, we're really nerve doctors. The reason that we work with the spine is we're working with the spine because we want to have an effect on the nervous system itself. The nervous system is protected by the spine. We've got this narrow tube that the spinal cord is going down in between all of those vertebrae. And if any of those vertebrae get into a malposition or have some form of instability, guess what? It's going to create neurological impingement and problems. So it's our job to try to understand where we're seeing restriction, where we're seeing impingement, and where we're seeing, I use the word resistance. So just like in your house, we have dimmer switches. And in my office, I don't have any dimmer switches, but in my home, I do. And maybe you have some dimmer switches in your house. And a dimmer switch is a lot like your nerves. And what happens is it's when those nerves get impinged, it's like dimming the lights. It's like the light's still on, but it's not as bright as it can be. And that's what we want to do, is we want to actually help to restore that by actually taking the pressure off of that, by restoring the function back to the spine, to actually turn that amplitude back up so those signals, those impulses from your nervous system can now send down through your body and actually traverse down through your body, turning things back on the way they should be without the pins and needles or the creepy crawlies. So again, what it is that we do is so different and so transformative by taking these 3 very precise x-rays, doing a careful examination, getting a good history, having a good understanding of what is the causative factors for any form of neuropathy, and then how to address it. So if you're experiencing some of these, or maybe you've been diagnosed with any of this stuff, maybe you've tried some things, maybe you've tried other practitioners, you've been to different neurologists, you've been to your GPs. Some simple tips are things that I would say. A lot of people say, well, can I go get a massage? There's 2 sides to that. Getting massage can always be helpful. I'm a big fan of massage, but sometimes, if we're having neurological impingement, massage could definitely help in some regards, but it can also be a hindrance, and it can actually compromise and create more aggravation, or aggravate the situation a little bit more. And it's hard to tell that until we do a careful examination. The other thing I'm a big fan of for forms of neuropathy would be decompression. Doing some form of just traction, simple traction at home. And we're not going to be doing radical things like hanging our head off the bed. That's going to be bad. I'm not going to do that. We're not going to recommend, pulling your head out or anything like that. But just rather simple, gentle stretches that will actually help open up and create a universal traction on the whole spine, because gravity is the greatest force that we all have to deal with on a daily basis. And as it's pushing down and compressing our spine, and when our spine's in a state of distortion, it can definitely be amplified by that. So if you've tried a lot of things and you're still looking for help or answers, we would be happy to help you with that. And you can call our office and set up for a free consultation. We'd be happy to do that and discuss, your case and finding out what's going on with you, and then how we may be able to help. So until we see you and see how we can help you, farewell, be well, and be grateful.